All right. Hi, everyone. It's always interesting to try new technology. This is my first time using this. I hope you like it. Let me give you a little bit of background about myself so that you know who's talking to you. I always think it's useful to know where the speaker's coming from. So I started out as a primary care doctor taking care of low-income patients, mostly people who had Medicaid or were uninsured, oftentimes people who were paying for their own care. And from that, we developed a network of clinics primarily for low-income patients, again, served by Medicaid. Eventually, as the number of clinics grew, I became the medical director, and then we became a health plan contracting with the government, mostly state governments for Medicaid, but eventually we got into Medicare, and we took care of people who were called dual eligibles, who have both Medicaid and Medicare. So I've had the perspective of a clinician, of a medical director. Eventually, I became health plan CEO. And then about 5 years ago, after I left Molina Healthcare, I got into investing, and I have invested in a small number of companies on my own and some others through some funds. But in the past year, my business partner, Juan Jose Oriana, and I have looked at 40 to 50 companies, most of them in healthcare technology. And so I want to talk to you about some of the lessons learned as you start out this program looking at digital health equity. I think it's always good to start with some of the basics. So we talk a lot in healthcare nowadays about value-based care, value-based contracting, but I find that we often are speaking different languages. So it's important to define what we mean by value and what we mean by value-based care or contracting. I go back to Michael Porter's original definition of value. And in healthcare, he defined value as outcomes in relation to the cost to produce that outcome. You can think of it almost like an equation or a ratio. Value equals outcomes divided by cost. Now, cost and quality are not the same, but they often go hand in hand. So you can improve value by getting better outcomes, or by lowering cost, or by doing both. We have a great deal of difficulty in measuring quality and outcomes, but we're really good at measuring cost. In fact, we can measure cost to the penny. So oftentimes when we're talking about value-based care and increasing value, what we're really talking about is changing or lowering cost and assuming that the outcome or the quality remains the same. Anytime we rely on assumptions, we get ourselves into trouble because our assumptions are often wrong. So it's important, I think, to focus on how we can better measure outcomes and quality. Let me give you an example. If you were to contract for a service, let's say it's a hip replacement, and we assume that all hip replacements are about the same and have about the same outcomes, and we enter into a fixed cost payment, like a case rate. We've created some value for the health plan because we've eliminated some of the risk and variation in cost. If you can contract with doctors or medical groups at a lower cost, let's say we're paying $1,000 for hip replacement and we find someone who will do it for $900. The contracting people would say they've increased value. The CFO would be pleased. Again, value has been increased. But people like the chief marketing officer, the chief medical officer, or the CEO may not look at value in the same way. They may say, yes, you've decreased our costs, but the quality is not there. And so while costs are lower, quality has declined and value may actually be destroyed. We've got reputational damage. We're trying to sell our insurance product to someone and they're not interested because we've got a bad reputation. We're not known for quality. And so value is very much in the eye of the beholder. Let's talk about a little bit about health technology. Health technology is a very rapidly expanding field. It's one of the hottest fields in healthcare right now. There's a lot of technology out there, and we're just now beginning to apply that technology to healthcare. And there's a great deal of hope and expectation that this will solve a lot of our problems. So if you're involved in a healthcare technology product of some sort, one of the things I always hear from people is we have a solution. Okay, well, maybe you do, maybe you don't. I think of technology as tools. I think since man discovered fire, technology has really been a tool that we use to solve a problem. For example, I need housing. If you come to me and say, I've built you a house, then yes, you have a solution for me. But if you come to me and say, I have a hammer, well, you haven't given me a solution. You've given me a tool. You may have built the best, latest, newest hammer ever. But if what I really need is a screwdriver, you haven't given me a solution. You haven't even given me the right tool. So it's very important that we understand the difference between solutions, which are global, and tools, which is where technology frequently comes in. I'll give you another example of this. Years ago, we were visited by someone who wanted us to outsource our claim system from the health plan. And they took us out to a fancy lunch. I always get nervous when people think that contracting discussions have to begin with an expensive meal. But after the meal, they approached us about outsourcing our claims payment to them. They had this wonderful claim system, and they were able to pay claims quickly and efficiently and low cost. And well, okay, well, I have a claim system, so our health plan doesn't really need a claim system. What is the value proposition here? Well, we can do it for less. How much less? So they told us the cost per claim. And the COO and I looked at each other and we looked at them and we said, well, that's very nice, but our current cost to pay a claim is a little less than half of what you are proposing to us. So there's no value there for us. So it's important that not only do you have the right tool, the right technology solution, but you have it at the right cost. All things in medicine really begin with the patient. In healthcare, that's not always true. Sometimes the solution or the tool begins with the health plan or the provider, but it's important to look at who is going to be impacted by this. Is this really something that they want or need? Again, getting back to our contracting solution for outsourcing claims, it wasn't really something that we needed. If they'd come to us and said, we can scan all your claims and remove data input, that's something else, that might have been useful to us. It's not a complete solution. It's a tool to improve our claim system. But you have to begin with the end user in mind. And when you have an idea that you think is going to solve someone's problem, it's really important to sit down with those people, a number of those people, and discuss it with them. Because you may find out that it's not what they need at all, or they're not interested. And you may find out that while you have a good product, it may simply be too expensive. So it's really important before you launch into a big product development to make sure you understand what the user needs and how they define value. Again, having a claim system that costs twice as much as my current claim system, no matter how good it is probably not going to drive value for the health plan. The next thing to think about is who is the customer. And a lot of these companies, I've talked to people who have great solutions. They're got a good product. Technology is great. It may even be affordable, but they haven't figured out who the customer is. And I always define the customer as the person that's paying for the service. So when you think about an electronic health record, the doctor is using it in the clinic or in the hospital, but maybe the doctor's not paying for it. The doctor may think that you've got a great electronic health record, but the health system thinks it costs too much. So has value been created with this new electronic health record system? I don't know. You have to get the people that are using it and the people that are paying it together to agree and define what is the value and are they getting the value that they want. We used to see this a lot at the health plan level. People would come in and they would have some new technological innovation and somebody in the company wanted to adopt it, but it wasn't worthwhile for the health plan, or it wasn't sufficiently value creating. And a business really only exists so long as it creates value. You've got to remember that. If you're not creating value for somebody, then eventually you're going to go out of business. So, I think that that's really an important thing to keep in mind. Are we creating value? Who are we creating value for? Are we satisfying the customer, the person paying for this? Now, with a lot of these entrepreneurs that are setting up new businesses, and one of the things we hear a lot in business is about the importance of culture. I've heard a lot of people say that culture is the most important thing, that culture triumphs everything else. And maybe that's true, but it also depends a lot on what you mean by culture. For example, if you're starting a business, sometimes a culture of thrift is very important. New businesses don't have a lot of money, and they need to conserve cash. So that might be an important value for your company. One of the things I often see with young entrepreneurs and new companies is they've gone out, especially recently, and been able to raise money. But raising money is not always enough, and it may come at a high cost, especially now. In the last, I would say, 9 months, because of worries about inflation and perhaps an impending recession, a lot of investors have pulled back and they're not investing. Or if they are investing, they're at significantly lower valuations. You may think your company's worth $10 million, and maybe last year it was. But this year, that same company might only be worth 5. And if you have to go out and raise more money, it's going to be diluted. So I think it's really important for entrepreneurs, especially in the tech space, to be conscious of costs and how they spend their money. Conserve cash if you can. For example, if you need furniture, look for used furniture. I mean, when we started our clinics, we bought a lot of used furniture. We bought couches and tables and chairs, and we had them repainted and recovered. They look brand new, but they cost us a fraction of new. And it's a good lesson to learn. Thrift is an important part of culture. Execution is an important part of culture. You can have a great idea, but if you can't execute on that idea, it means nothing. So culture is important, but it's the right culture. One of the things I always tell people who are starting up a business, I think there are a couple things you need to do right off the bat. I already talked about the value proposition and who the customer is and what you're trying to do, but it's important to be able to put that down into a mission statement for your organization. What specifically are you trying to do? What is it you're trying to do? And for who's the customer? Who are you doing this for? And you need to be able to get that into a single sentence. It sounds silly, and sometimes people think, well, this is business mumbo jumbo. But I always found that with our companies, if you could do that, then everyone could get on board to understand what it is the company's trying to do. And that's very important because it creates cohesion, and that mission is critical. The next thing are the values. I think every company needs to have some guiding principles or values. They're almost unwritten rules that set the boundary conditions, what's acceptable and what's not. And I like what I call the rule of 5s. We need to keep things simple for the people that work for us. And I have 5 fingers. So if you tell me what our goals are going to be for this year, it should be 1, 2, 3. Simple things that everyone in the company knows what they are and can agree on. If you have 17 goals, then it's really difficult for me as an employee to figure out what's really important in this company, what should I be working on. I might be working on point number 16, and it might be point number 3 that is the most important goal. So it's important to keep it simple, keep it to 3 to 5 goals, and the same thing for your values. What are the 3 to 5 things that you want everyone in this company to know are critical to the way you operate your business? It might be thrift. It might be quality. It might be compliance. We are in a highly regulated industry in healthcare. So those are other things that I think are really important. And then finally, the selling cycle. If you've got a product, especially a technology product, and you want to sell this to some organization, whether it's a medical group or a health plan, or maybe even a government agency like Medicaid or the Department of Health Services, you're going to have to go in there and make your pitch. And I can tell you from my days as a CEO, we got pitched all the time. And a lot of well-meaning people with good ideas would come and pitch us on something and ask for a contract. Well, first of all, the contracting cycle in health plans is long. It can be a year. And in government, it can be even longer. So as you're thinking these things through, you need to be sure that you're going to have enough cash and enough sales options out there that you can last through the sales cycle without running out of money. The second thing is everybody has good ideas. Nobody comes to me and says, I've got a terrible idea, but I want you to pay for it. But good ideas are not what we pay for. We pay for value, and that means outcomes. So when you tell me that you've got a product that is something that we should adopt, I need proof. I don't need demonstrations. Someone brings me their software and the demos always work. So the demos don't really mean very much. I'm interested in results. Have you applied this in a similar setting with patients, and what were the results? I'll give you an example. I know of a company that was given a list of patients, and they had a program to do HIPAA compliant texting and patient engagement. This is something health plans struggle with. We need to engage our members. We don't know how to do it. So it's a great idea, but does it work? And for a long time, it was a promise. They got a contract with a health plan. They were given 40,000 names of patients who had not had a doctor visit encounter for anywhere from 18 to 48 months. Now, if you're a Medicare plan and you depend on risk adjustment to increase your premiums, you need people to see the doctor so that we can get the data, so they can get our risk adjustment scores up. So this is critical to them. They were able to get 25% of those patients to see a doctor. And I don't mean schedule an appointment. I mean generate a claim. That's proof. That's the kind of solid results you need. You may not have that as you're starting out. So you may have to invest in some sort of pilot program. You may need to affiliate with a university, a medical school, a school of public health, maybe a medical group or a health plan to test this out. And you might even have to give your product away free to prove that it really works. It's an investment that you're making. And I always tell people, be very careful how you do this, because entrepreneurs always think that their solution is great. We have a built-in bias. So it's important that you affiliate with someone like a medical school or a university or a school of public health that has people who can help you plan a study design and then evaluate it mathematically using statistics to show whether or not your product actually does what it's supposed to do and delivers the results that are going to be valuable to the customer. And if possible, take that data and publish it in a peer-reviewed journal. That gives huge proof. Health plans and the government are very risk averse. A promise that something will work in the future is rarely going to generate a sale. But if you can go in and show in a particular group of patients or in a particular setting that your product actually worked and demonstrate it with statistics, then you've got something that you can sell. This is not unusual. I mean, when you think about new drugs, drug manufacturers, they have to go through clinical trials, phase 1, phase 2, phase 3, and they have to prove that their product works. And these are rigorous studies, and they have to be safe. So if you have a technology solution, you really should look at that the same way that a drug manufacturer does. Can I prove my product really works, that it's safe, that it's cost effective, that it meets my customers' needs? These are all the kinds of things you need to think about as you look at technology. And remember, it's a tool. You're helping somebody solve a problem. I wish you all well with this. I think the speaker that's following me, we have something in common. We both trained at Hopkins. And I think it's really important that a lot of the solutions we generate come out of healthcare, and they're not just isolated technological solutions, but people who really understand healthcare, know what's necessary, and then generate the ideas and then validate them.